Coming up on this episode of Discover Health Podcast.
What we're talking about is really the science behind why people get chronic disease of all kinds, including autoimmune disease, how to prevent it, but also how to reverse it when it's there. And so, I kind of tell people, don't let anybody ever tell you they don't know where your chronic health issue came from, whatever it is, right? Small, big, medium. It comes, we know where it comes from. Don't let anybody tell you that. That just means they don't know where it came from. And don't let anybody ever tell you can't make it go away. That just means that they don't know how to make it go away.
Welcome to the Discover Health Podcast, where we explore the power of gut health, nutrition, and lifestyle to help you feel your best every day. I'm Dr. Josh Sharp, your guide on this journey to better digestion, more energy, and overall well-being. Ready to start discovering? Let's hit the trail. Welcome back to another episode of Discover Health Podcast. I'm your host, Dr. Joshua Sharp, and joining me today is Dr. David Bilstrom. He is a quadruple board-certified functional and regenerative medicine physician. He's the medical director of the International Autoimmune Institute and a leading expert in reversing and preventing autoimmune disease. He's passionate about helping both children and adults address the root cause of chronic illness through functional medicine, epigenetics, and restoring optimal gut health and immune health for this generation and generations to come. Dr. Bilstrom, thank you so much for joining us today.
Well, thank you, Joshua. My pleasure.
So the first question I would love to ask you is, I know that you have some medical training and medical background with an MD behind your name. What was it that first got you interested in functional medicine and regenerative medicine? And, what led you to kind of turn away or shift your focus away from traditional medicine?
Well, sure. So I am a traditionally trained medical doctor, went to University of Illinois Med School, University of Colorado for residency. My residency was in something called physical medicine and rehabilitation. So rehab docs do a lot of musculoskeletal stuff, but they also take care of people who have had brain injuries, strokes, rheumatoid arthritis, spinal cord injuries, and all this kind of stuff. And we tend to be the place that people get sent to when no other specialty quite knows how to help folks. Ultimately, a lot of chronic health issues, we're kind of tasked with taking care of those folks. And so my original area subspecialty was spinal cord injury. So everybody that I saw, my first job out of training was paralyzed waist down, neck down. Very complicated population. Every organ system, not just the nervous system, the spinal cord are involved, bowel, bladder, musculoskeletal, nerves, brain, hormones, gut, you name it, kidneys, liver, all involved. And they're so sensitive to medications that something that we wouldn't even think twice about, like a sinus congestion medicine, might actually kill these folks.
Wow.
And so we end up becoming their primary care providers, even though we're ideally specialists, because we need to really know this stuff. Otherwise, we can't help them as much, but also we got to make sure they don't take things that might seem, innocuous to anybody else, could actually kill them. But it's so hard to take care of these things, and there's not a lot of medicines for this stuff. And even if we got a medicine, we get the ramp up of the dose. It's just starting to do the job we want. Then the side effects start kicking in and they're so profound. We can't use the medicine. We get rid of it. We try the next step. Well, you can easily run out of meds and they're still, really not well and not living their fullest life, their high quality of life as high as we can get. So I kept thinking, well, is there something out there that I didn't learn in my traditional training that might be able to help these people? And wouldn't it be lovely if it had no side effects, which is a pretty tall order. You referenced some commercials. Maybe we'll get to that in a second. They all have a gobs of side effects. Well, acupuncture kept popping up as good for bowel, bladder, musculoskeletal, you name it. Acupuncture for 5,000 years it's been around. It can really help in a lot of these areas, and there's no side effects. And so there's nobody around me that did acupuncture back in this day. We're talking decades ago. And so I trained at UCLA, and that's why I ended up getting boarded in medical acupuncture. I came back and, oh my gosh, it worked so much better than I ever thought. And no side effects, right? And so rather than this last ditch effort to all my partners, patient population, not just mine, but all these other patient populations, including pediatric rehabilitation. They started sending me kind of the worst, the people that just didn't get all the benefit or anywhere near the benefit. They got better. I'm like, oh my gosh, this works so much better than I ever anticipated. But then it got me thinking, what else is out there that I didn't learn in my traditional training? And sure enough, there is a ton. Even back then, there was a ton, let alone with this explosion of scientific knowledge nowadays. Like 30 years ago, I was lecturing different places of the world, like Brazil, New Zealand, United States, all this. And I would say medical knowledge in 1850, you get done with medical school, medical knowledge is going to double during your lifetime as a medical doctor. Well, it was doubling every 7 years by the 1945s, right? And then by 1970, it's going to be every 2.3 years. By 2021, it's going to be every 73 days. Well, we kind of got to that point, and it's like, wow, is there a lot of knowledge out there? Now, that is so empowering because there's so much great information out there of how to take care of folks, how to prevent chronic disease, but also how to reverse it. Though it also makes it incredibly challenging for most medical people to keep up with this kind of stuff because they're still focused on medications, right? And if they can keep up on the latest medication and the latest profound side effects of this new medicine so they don't kill people or make them sicker with this medicine, that's about all you can ask a lot of the time, right? So what we're talking about is really the science behind why people get chronic disease of all kinds, including autoimmune disease, how to prevent it, but also how to reverse it when it's there. And so, I kind of tell people, don't let anybody ever tell you they don't know where your chronic health issue came from, whatever it is, right? Small, big, medium, we know where it comes from. Don't let anybody tell you that. That just means they don't know where it came from. And don't let anybody ever tell you can't make it go away. That just means that they don't know how to make it go away. They may have been great at diagnosing you have this named disease, but they don't quite know this stuff. Hopefully sooner than later, everybody will know this stuff though.
I hope that you're right. I really do hope that you're right, but it feels like the information, there's been so much great information out there for decades and decades and decades, but he who controls the education, they're like the filter for the people that are learning. And so I just feel like the filtering organizations just have so much power and so much control over what is taught. So I hope you're right.
And you really have to go out of your way after you're done with your traditional training then to get this kind of knowledge, because to your point, you don't really get it in the traditional, like I didn't, but that you really, so people that know this stuff, you got to give them a lot of credit because they've gone out of their way to learn this stuff despite all the factors out there that might make it challenging. Like you have families, you have a practice, you got to take the dog out, all this kind of stuff. And you still find time to learn this stuff.
Yeah, I would say, I learned a lot of great stuff, very useful stuff in school, in chiropractic school. And my mind was open to more natural approaches and a lot just different way of thinking about things than what you would typically be exposed to in just a regular everyday education. And that was great. But I would say the vast majority of stuff that I've used every single day and that has made the biggest difference in caring for people was stuff that I had to learn reading books. It was stuff I had to learn going to other seminars. I mean, I feel like tens of thousands of dollars, of just trying to get my own education and expand my knowledge base. That's where most of the stuff that I use comes from. And, I don't regret doing it. It was costly, but I feel like it's made a difference for so many people, just learning the new things and learning how the body actually works and what's missing. So one of the things that I wanted to ask you about, and I just skimmed over it in the introduction, is you help people with autoimmune diseases. Now, first thing I want to ask you is autoimmune diseases, they seem like they're everywhere right now. The statistics are just going through the roof on the incidents, and I think there's so many people out there that are undiagnosed that are walking around with, autoimmune disease. What do you think is driving this huge increase in numbers of autoimmune in America?
Yeah, there is an absolute epidemic of chronic disease in general, but autoimmune disease particularly, uh, to the point where if you have an autoimmune disease, you're not alone. But if you don't have an autoimmune disease, you're probably going there and you probably need to do something to prevent it. So, for example, the numbers would be, hey, let's take the top 10 autoimmune diseases, rheumatoid arthritis, multiple sclerosis, kind of the psoriasis, these common ones. And we'll say how many Americans have this. But that totally estimates the number out there because there's hundreds of named autoimmune diseases. Truly, though, it's really one disease that can attack any body part, which kind of makes it nice when it comes to preventing reversing because you kind of prevent them and reverse them all in the same way. But it's also where if you get one autoimmune disease and you don't get rid of that autoimmune disease and fix why you got it, you get a second, third, fourth, fifth, sixth. I've seen 8-year-olds with 4. I've seen women in their 20s with 7, all this kind of stuff. And so uh, there's an autoimmune disease that I named based on a positive anti-nuclear antibody blood test, a positive ANA. And historically, they're antibodies attacking your nuclear material, anti-nuclear antibodies. Antibodies attacking your nuclear material, attacking your own DNA. So the DNA, the genes in your cells tell the cells what to do. So like the last thing you want to do is piss off your DNA, right? Because it's going to start telling all the cells the wrong information. So here's this anti-nuclear antibody, but didn't have a name. And people would get a positive ANA after they'd probably been to 3 to 5 docs, 3 to 5 years, feeling sicker. And then somebody says, well, you ought to do a blood test for autoimmune disease. We're going to check this ANA. Oh, you're positive. Now, unfortunately, what people are told is, well, there's no name for this. And we're not quite sure what to do if there's no name, right? If we had a name, we know what med to use, right? But we don't have a name. So what we're going to do is watch. But on average, within 3 to 5 years, you're going to start developing other antibodies against other body parts.
Mm-hmm.
And then when that happens, we can tell you what disease you have based on which antibodies are produced 3 to 5 years later. But you're 3 to 5 years sicker by the time you actually get the diagnosis. And then all they offer is a medicine that kind of puts a bandage and a bullet hole, doesn't even, fix the problem or get rid of the reason why you got the problem. And you continue to get worse over time and add new autoimmune diseases. So I named a positive ANA Bilstrom's nuclearitis, a little bit akin to Dr. Hashimoto, who named Hashimoto's thyroiditis, the autoimmune disease of the thyroid, where antibodies attack the thyroid. So I go, okay, now there's a name. And now when you get a positive ANA, we can put a name on it, but we're not going to use the meds. We're going to actually go after why you got it so we can make it go away. And then we've done our due diligence to prevent you from getting new autoimmune stuff as time goes on. And you don't just keep getting worse and worse, but just a positive ANA in the United States, 50 million women in the US alone have a positive ANA.
50 million.
And we're not talking about the rheumatoid arthritis and the multiple sclerosis and the psoriasis and all those kind of things. We're just talking about a positive ANA. 50 million American women get 80% of all autoimmune disease. Mm-hmm. And it's like, wow, that blows the lid off, I think, of how many people are out there with autoimmune disease. But also, I think kind of to your point, is a lot of people walking around out there with this positivity that aren't feeling good, but nobody thought to test for it. And wow, we got to prevent stuff and we got to reverse stuff, but it's totally possible with the science we have.
Yeah, absolutely. So in terms of the rise, what
factors? To answer your question, I think about why. I got excited about this subject. I apologize, Joshua.
No problem. Yeah, I was just going to ask, going back to what do you think, what are the factors that you think have been driving this, significant increase in ANA, in positive ANA?
Yeah. And truly, when I see somebody with a positive ANA, they probably have antibodies attacking their thyroid by this time. They have a second, the Hashimoto's already. It's very common this ANA isn't even your first, right? You kind of do your testing and then actually, I think this is your third or fourth already, right? Because we can see the other 3 that were there before. And so to your point about how important the gut is, right, is the gut is such a big central mechanism, including 80% of the immune system surrounds the gut. So whenever you see an immune system issue like an autoimmune disease, the first thing people should think about is what's going on with the gut. And so a gut disruption, which is so common, we're a society of totally messed up guts. Now, for those out there that say, I don't have any gut issues, You can have a totally messed up gut and have no gut symptoms. It's just showing up as everything outside the gut, right? Including celiac disease, the autoimmune disease that attacks the gut, and wheat proteins become like battery acid. So every time you're consuming wheat proteins like gluten, gliadin, you might as well be drinking battery acid. And you think, well, between that and my immune system attacking my small intestine, I should have a terrible gut problem, right? And I'd say, you would think so. But 80% of people with celiac don't have any gut symptoms, but they're a mess outside of the gut. Only 20% with this terrible gut thing actually have gut disruption symptoms, but they also feel crummy all the way outside. So the gut's a super central mechanism. But that tends to lead to a lot of these other drivers where we get vitamin deficient. Now, the standard American diet, the SAD diet, has no nutritional value. So that'll inherently get you nutrient deficient, and your body needs nutrients, vitamin, minerals, such things to make things and fix things, be happy and healthy. But if you got a messed up gut, you can be eating great food, nutrient dense food, organic, non GMO food, but you're not going to be digesting it and you're not going to be absorbing the nutrients in your body, and you're still terribly vitamin deficient. The gut's the main organ of detox. Now, you probably don't have the nutrients to run your detox pathways like you need to and dump toxins into the gut so you can poop them in the toilet. With a messed up gut, even if you get them there, they don't go in the toilet. They reactivate and reabsorb back in the bloodstream, and toxins build over time. And we live in a super toxic world. If you're not getting rid of them faster than they're coming in, they're building, especially when you got this messed up gut. And then the gut's so important in hormones and hormone balance. Can we make hormones? Can we balance them? And so hormone deficiencies and imbalance, including a really big one in women called estrogen dominance, where women gets too much estrogen down to progesterone. Balance is off, both really important. Balance is more important. Big reason why women get 80% of all autoimmune disease is this estrogen dominance. Maybe we could talk about what the signs of estrogen dominance are long before you get the autoimmune, so you know it's coming and you can fix it before you get there. And then you got things like infections. And so we now know that infections are part of all chronic disease. We've known that kind of for a long time when it comes to autoimmune disease, but we now know, kind of because the immune system is involved in every chronic disease, not
Mhm.
just the classics, but it's involved in heart attacks, stroke, osteoporosis, Alzheimer's, dementia, Parkinson's, 70% of all autism is one particular autoimmune disease, all the brain stuff, all has infections. And so they just tend to be the bad bugs, though, that don't give you an obvious infection. They don't give you a fever, chills. They get in and they start creating this inflammation that then drives disruption of an organ, which drives chronic disease. And you can test them on a blood test. Any lab can run the test for these infections. Any digestive stool analysis out there, poop test, will tell you which ones are in the gut that shouldn't be there. So the infections are a big one. Stress hormone cortisol. Stress hormone cortisol, they call it the stress hormone, should go up, down with intermittent stress, like emotional stress. That's what the fight or flight, life or death mode cortisol response is designed for, is intermittent emotional stress. It's not designed for 24-hour a day, 7-day a week, 24/7 stuff, which is this physical stressors. So like a vitamin deficiency, a toxicity, a hormone imbalance, a gut disruption, that's all a physical stress to the system. And what that does is it kicks the stress hormone cortisol up into the stress mode, like an emotional stress would do. But because it's 24/7 stuff, it locks it in place. And then when you're locked in place with cortisol in the fight or flight mode, you can't fix nothing. The body doesn't heal
Absolutely.
in the stress mode, right? And it's one thing after another, after another, after another. And so sort of, kind of, that's kind of the basics of what drives this stuff. But you look at that and it's like, well, this is our world. Everybody's stressed to the gills. Everybody's vitamin deficient. Everybody's toxic. Everybody's got a messed up gut. And that's why I kind of say, well, if you don't have an autoimmune disease already, and a lot of times you will, but you just don't know it. If you're one of the 50 million women that has that one autoimmune disease, the Bilstrom's nuclearitis, but if you're not there, you're probably heading that direction. And just know that was totally preventable. It's nice to know if you're heading that direction, but also it's totally reversible as well.
That's great to hear. And there's a lot of hope in that messaging that even if you get a label, even if you get a diagnosis of an autoimmune condition, That doesn't mean you're stuck there. It doesn't mean that you have to just go right into your bucket with your label. Oh, here's your meds, and that now you're just gonna keep getting worse, and we'll just keep increasing your medication until eventually you die from that or side effects from from the medication.
Right. That's right.
So
Yeah.
before we get to that stage, before we start down that dangerous path, what are some signs and what are some symptoms? What are some things that people should be paying attention to that's a sign that those inflammation levels are creeping up? That's a sign that maybe they're, could have that ANA positive, maybe they could have that immune activation going on. What are some things that people could be looking for? When your drainage system backs up, your body cannot eliminate waste effectively, and that leaves you vulnerable to chronic inflammation and illness. Bowel Mover supports healthy elimination at the colon, keeping your drainage funnel flowing. Find it at discoverhealth.gethealthy.store. High quality supplements for real healing. And don't forget to use code FIRST10 for 10% off your first order.
Yeah. 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 So this kind of stuff oftentimes starts in childhood. And so the immune system, I think, is a great example of how the body likes balance. There's always a sweet spot right in the middle of everything. So, like blood pressure. Well, you never want to be too high with your blood pressure, but you don't want to be too low either. Blood sugar. You don't want to be too high. We don't want to be too low either. So there's always a sweet spot, right? But with the immune system, that's one of the things I find so fascinating is when the immune system loses its set point, not too high, not too low, it actually moves up and down at the same time.
Right.
So you get overactive and underactive immune system issues. Now, some people start showing with the under, some start with the overactive. Overactive immune system issues are all the autoimmune diseases, but also allergies, asthma, and eczema, the skin issue. So, like in children, they might start showing up as this disrupted immune system with allergies, asthma, or eczema. But if they do, you go, oh, you lost your set point. If we don't get you back to the middle, or you move them farther away, you're going to get the autoimmune disease. Now, the underactive immune system issues, cancer, and that's why they talk about cancer being the flip side of the same coin that's autoimmune disease. Everything that drives autoimmune drives cancer. Everything you do to prevent autoimmune prevents cancer, and everything you do to prevent cancer prevents autoimmune. Now, you also got down here in the underactive these chronic infections that drive chronic disease,
Hmm.
sneaky ones that drive chronic inflammation, chronic disease. But you also have obvious infections. So this is like recurrent ear infections, strep throats, sinus infection, urinary tract infections. I get bronchitis every January, pneumonias, and all these kind of obvious infections. And so you also see this in childhood. Oh, my child has recurrent ear infections, strep throat, sinus, UTIs, that kind of stuff. Okay, so if you show up here or here, you go, oop, you lost your set point. We got to get you back to the middle because you don't need this up stuff. You don't need this down stuff. And you don't need to keep moving away as time goes on and get the autoimmune and the cancers, right? And so this kind of disruption of the immune system actually starts really early. Okay. And I think that's a call to action that, hey, my child has a disrupted immune system. The science is clear why that happened. We're going to make it go away because it kind of stinks to get recurrent infections, kind of stinks to have the asthma and the allergies. People die of asthma, even though they're well controlled on medications, this kind of stuff. And so it can start early. Now, in women, 80% of all people that get autoimmune disease are women. It can start, a really big sign can start early. And this is that estrogen dominance, too much estrogen compared to progesterone. And every cell in the woman's body has receptors for estrogen. Every cell in the body needs estrogen. Every cell in the body has progesterone. Every cell needs it. But the balance can be really important. So typically, what it's going to show up with a while, couple years, couple decades before an actual autoimmune or cancer, right, is hormonal menstrual issues. Bad flows, bad cramps, premenstrual syndrome, PMDD, ovarian cysts, polycystic ovarian syndrome, fibroids, endometriosis, lumpy breasts, fibrocystic breast disease, and even infertility is all estrogen dominance. So if any women have those, and nowadays it's almost like, well, what one doesn't have that? The world around us throws hormones off so dramatically. You got this estrogen dominance. Yeah, you don't want that stuff because that's going to lead to autoimmune disease, right? Now, also because estrogen revs and progesterone calms, women start getting rev without calm stuff. I seem to worry too much. I'm a worrier. I'm just too anxious. I have anxiety. I can't shut my brain off to sleep at night. maybe have panic attacks. That's all the rev without calm stuff. And nowadays it's like, well, what woman doesn't have some of that stuff, right? So estrogen dominance shows up as the rev without calm and the hormonal menstrual. They all stink. You all want to get rid of it, but that's estrogen dominance. So for example, I'll give you an example when it comes to cancer. Okay. There's a big driver of autoimmune, but a woman that has estrogen dominance before menopause, any of the rev without calm, any hormonal menstrual stuff, estrogen dominance before menopause has not twice the risk of breast cancer, not 3 times or 4 times or even 5 times the risk. They have a 5.4 times greater risk of getting breast cancer before menopause. We have an epidemic of breast cancer. Women are getting metastatic breast cancer in their 20s. Over 100,000 women in the US every year, when they're diagnosed with breast cancer, it's already metastatic. Over 100,000, 120,000. Now, that's bad enough. But what they also see is with this estrogen dominance before menopause, it will increase your risk of getting any metastatic cancer, the kind that starts one place and travels, the worst of the worst, 10 times greater risk of metastatic 10 times greater risk of dying from metastatic cancer your entire life. Yuck, right? But when we can fix this, right? And we can make the hormonal menstrual stuff go away, we can make you so chill and you sleep like a baby. And that's all lovely. But now, by fixing this estrogen dominance, we prevented the autoimmune disease. We prevented the breast cancer, prevented the metastatic cancer deaths, simply by doing that one really important central mechanism, root cause of all this. And I think that's really profound that we can know where the cancer is coming or autoimmune is coming long before it gets there and actually be able to shut it down. And when we do that, you feel hunky dory, totally great now. And you've done your due diligence to try to maintain that your entire life.
Yeah, those are important things to know about. Now, for the woman that's listening, obviously we talked about, you mentioned that 80% of autoimmune sufferers are women, and estrogen can be such a major driver of that
Estrogen, estrogen dominance. Yeah.
estrogen dominance can be such a major
Balance.
driver of that.
A lot of docs, you'll hear, oh, estrogen, that was your problem with this breast cancer diagnosis. And it's like, well, no, 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 no. It's the imbalance that's the problem. Yeah.
Absolutely. Yeah,
Yeah.
estrogen dominance. Where do you feel like the estrogen imbalance, what factors in our environment, what factors in our life are contributing to such out of balance estrogen levels?
Yeah, yeah, beautiful question. Now, typically the first thing that happens is actually loss of progesterone. And so we've talked about the stress hormone cortisol getting stuck in the stress mode. So cortisol is part of a hormone production cascade called the steroidogenic hormone production cascade. And it actually all starts with cholesterol made by the liver. And so cholesterol gets a bad name, but we'd be dead without it because we couldn't make all these hormones. So cholesterol made by the liver then turns into really important hormones like pregnenolone. They call it the brain hormone. Also called the mother hormone because then that converts to estrogen, estradiol, estrone, testosterone, DHEA, progesterone, and but now cortisol. Now cortisol ideally in our body converts to cortisone. So people may say, well, I don't want any of this cortisol stress hormone. I go, well, you'd be dead without it. It's actually the only hormone we'd be dead without. You might feel like dying if you don't have enough thyroid, but you're not quite dead yet. But cortisol, Addison's disease, can't make cortisol, you are dead. But when cortisol gets stuck in the stress mode, it becomes very inefficient at converting to cortisone, the steroid hormone we're supposed to make to get rid of inflammation. So people use steroids all the time. Cream, shoot it up your nose, your lungs. For asthma, I'll shoot your knee. We'll take it by mouth, prednisone. So we use steroids. Cortisol should turn into cortisone to keep away this inflammation. You don't even need all these steroids. If you get better with steroids, you know cortisol's stuck in the stress mode because you're not converting to cortisone efficiently. But what happens is it gets stuck in the on position. So cholesterol shunts to cortisol production. And then you're in a position to stop making all these other important ones. The first one that usually drops is progesterone. Estrogen hasn't risen yet, but progesterone's dropped. Well, here's the hormonal menstrual stuff, the rev without calm stuff. But then here comes the gut. Now, the gut disruption that caused toxicity, vitamin deficiency, hormone imbalances might be why cortisol's all stressed out in the first place. But now you can't detox because it got so messed up. Well, now a woman's ovaries that make the healthy new estrogens because hormones keep away inflammation. By doing that, they keep away disease. Like estradiol, healthy new estradiol, prevents heart attacks and strokes, prevents cataracts and macular degeneration, prevents osteoporosis, prevents fine lines and wrinkles on your skin, and is actually profoundly important for gut health, estradiol. But after the estradiol, for example, has been in your system for a while, doing this great work to keep away inflammation and keep away chronic disease, it gets dinged, it gets beat up, and now it's irritating and toxic to the system. So now you got to run your detox pathways. Now you got to dump them in the gut. Now you got to poop in the toilet. But here's this detox problem where these old toxic estrogens actually reactivate and reabsorb through the leaky gut wall, leaky gut, and
Hmm.
get back in the bloodstream. You can't get rid of them, and they just build over time. So then women will get this double whammy: too low in progesterone, too high in estrogen, and it's like, yuck. That estrogen dominance is not just the drop, but it's also the up all at the same time.
Yeah, it makes a lot of sense. And estrogen, obviously, as you pointed out, is vital. We need it. But it feels like these days, estrogen is all over our environment. There's plastics out there that can mimic estrogen. There's hormones that are used in, food production that can dramatically raise estrogen. There's birth control medications out there that are, putting extra hormone into kids. There's, so many other factors out there based on, what you're talking about makes so much sense. The gut playing such a huge role, leaky gut, reabsorption, unable to detoxify. How, in your opinion, what's the contribution from estrogens that we are getting from our environment and just our body's normal estrogen and inability to effectively convert and detoxify? Which one is a bigger factor for a lot of people?
Yeah. Going back to kind of an inability to detox
Hmm.
effectively, and our world is so toxic, including these estrogen-like toxins, hormone disruptors, estrogen disruptors, they're called. They're all over. They're getting in all the time. If we can't get rid of them faster than they're coming in, they're building in the system. And so this is where I'll see, ideally a woman's menstrual cycle should start someplace between 13 and 15, 12 and 15 years of age. But I've seen as young as 5 and 6 breast buds and menstrual cycle starting. Now, ideally, the menstrual cycles are supposed to start when the ovaries go, okay, I'm waking up here. I'm going to be working for the next 40 years and I'm going to start making estrogen, age 12, 13, 14, 15. But all these estrogen like toxins that come in from the environment can build over time, especially when the gut's disrupted in young girls, let's say, they've been antibiotics, and those kind of things, preterm birth. They had to be in the neonatal intensive care unit for a couple days, all these kind of things that drove a gut disruption right from the get-go. They can't get rid of toxins and they're building. And then here they are, 5, 6, 8 years of age, all these estrogen like things are in the system. The system goes, well, it must be time to start making breast buds. It must be time to start having menstrual cycles. And you go, well, that's messed up. It's not even the real estrogens, of course. It's all these toxins. And then you go, wow, that's kind of a mess in itself. This kind of stuff starting early, but you got a disrupted gut. You can't get rid of toxins. You got all these, bad things from the environment building in your system. You probably got vitamin deficiencies. It probably messed up thyroid because that's a really common hormone to get messed up in children. Most docs don't look deep enough to find the messed up thyroid issue, but it's there and that's messing everything up. And so, these toxins are really not good for all this kind of estrogen dominant stuff. And here's cancer ultimately, autoimmune disease ultimately. And then to your point, too, Joshua, I think that it's so important people know this. The treatment that people get, like women, when they get these hormonal menstrual things, even if they start their cycles at the right time, but they got the bad flows, bad cramps, all this hormonal menstrual stuff, the usual thing is to give them oral birth control pills. And that puts people into menopause, shuts down everything. That's why you don't have cycles, right? And so menopause is appropriate at the right time, 40, 50, 55, 60. Not so great in your teens and 20s to be put into menopause, but at least you don't have that bad crud going on, right? All the things we listed. But oral birth control pills are estrogen based.
Hmm.
you got estrogen dominance, driving autoimmune coming up, driving cancer, and now you put more estrogen into the system, it makes everything worse. You may not have the hormonal menstrual things and think that we took care of it with this oral estrogen birth control pill, but it actually made things worse.
Yeah.
Yeah,
And
and that's not
you set
good.
yourself, yeah, as you pointed out, you set yourself up for, unfortunately, increased risk for all kinds of other bad stuff. You made the problem worse.
Now, ideally, if you gotta do that to get through your day, you're a 16-year-old girl in high school, well, you can't have menstrual flow so unpredictable and so extreme that you're sitting in your desk in a class, and it all happens right there. You're right? Yeah, so you gotta do what you gotta do to get through your day, but when you're put on those, you should go, "Okay, well, at least I can get through my day now without a lot of this bad stuff happening, but now I gotta go back and see folks like you, myself, other people that know this stuff and fix it. And then by fixing it, we'll fix the reason why the hormonal menstrual stuff was off.
Hmm.
You won't have that issue anymore. You can come off the birth control pills. You'll be great. And by, actually fixing the issue, the estrogen dominance, now you've done your due diligence. We won't get the breast cancer. You won't get the autoimmune disease and all this other kind of stuff.
Yeah, I think that's a powerful distinction. Maybe there's a time and a place, but just recognize that dumping hormone into your system isn't fixing the problem. That was, your body is designed to regulate those things on its own. And if it's not able to do that, there's something wrong. There's something going on. And that just dumping hormone in doesn't do anything to change that underlying condition. And that makes a lot of sense. And I I feel like a chicken or the egg situation. You were talking about things that happen in childhood that set the kid up for poor detox pathways, for poor ability to detox hormones. We're in a toxic world. We're already in a toxic world, but the better that your body can get rid of waste and get it into the toilet, then the less likely that that toxic world is going to affect you as much as someone that has poor detox pathways that can't get the waste into the toilet. So let's go deeper a little bit. Let's dive deeper into the toilet issues, into the gut issues. What do you see are some factors in childhood? What do you see that are some factors early on that maybe moms could be looking at to try to protect their kids, to try to help their kids protect their gut, protect their microbiome? What things should they be looking at? What things should they be working on with their kids and for themselves?
Yeah. So you'd like to think when the baby pops out, everything's fully functional, fully formed. But that's not quite the case. So, like the liver takes about 8 months after we're born to become fully functional and all this. And the organ liver, huge in detox, huge in making so many important things that we need to stay healthy. Every body part needs the liver to make important stuff. The liver has to make all the nutrients the eye needs to function. So if you have eye issues, first thing you think about is liver. But it's easily dinged at that young age. And so what they see is the liver is supposed to make a really important thing called TUDCA, capital T, capital U, capital D, capital C, capital A. And that
Love
stands,
touch.
it took me about 3 months to be able to memorize the name of it. So it's tauroursodeoxycholic acid. And
Perfect.
if the liver's not making it, whether you're a child or an adult, it actually is a super central mechanism in all the things that we call the civilization diseases nowadays. All these things that are so much more common than they used to be. Heart attacks and strokes. Well, guys are having heart attacks in their 20s. Cancer. Oh my gosh, women get metastatic cancer in their 20s. Dementia, Alzheimer's, Parkinson's, type 1 diabetes, type 2 diabetes, all the gut stuff and autoimmune things, cataracts, macular degeneration, chronic kidney disease, even the tiniest hospital is a big kidney center nowadays, all this kind of stuff. And so when a child is a preterm baby, usually that's 4 weeks or more before the due date, sometimes 3 weeks or more. The liver doesn't make enough as much TUDCA as a term baby. So the preterm baby, it has a profound increased risk of type 1 diabetes during childhood, where the pancreas won't make insulin, the hormone that controls blood sugar. Terrible disease. You got to be on insulin pumps, insulin shots. And a huge increased risk of type 2 diabetes, insulin dependent, insulin resistance diabetes, where you can have all the insulin in the world. Receptors on the cells are resistant to insulin. It's almost like you don't have insulin in your fourth and fifth decade of life. So it puts you in a really bad place right from the get go. right? Now, if a baby has jaundice around the time they're born, the liver just got dinged. Bilirubin, as the liver's got dinged, it gets in, you can turn a little yellow. 25% increased risk of type 1 diabetes. The liver won't make the TUDCA, and huge increased risk of type 1 diabetes in childhood where they just won't make the insulin pumps, insulin shots. Type 1 and type 2 can be reversed, even if it's fully formed. I just want to kind of throw that out there a little bit, but it sets the system in a bad place. Now, also, any antibiotic pregnancy, because the intestinal microbiome of the baby is actually being set up before they're born. It's getting set up during the pregnancy. Antibiotics during pregnancy will disrupt the development of the fetal intestinal microbiome. And the other 3 microbiomes, maybe we can talk about some other time. The 4 microbiomes of pregnancy that determine the health of the fetal microbiome development. So any there, or like a shot for like, oh, you have strep B. We got to give you a shot of antibiotic right before you deliver. That'll mess up that microbiome. Antibiotics anytime during the first 8 years of life. I used to say 0 to 3 months is the worst time for an antibiotic. 3 to 6 months after you're born is the next worst, and then 6 to 12 months, where even one dose of an antibiotic totally disrupts the intestinal microbiome, and you're not going to fix it unless you have some help. Newer data that just came out in November from Scripps Research there in La Jolla, I thought was a super cool study where they talked a lot about how the immune system actually takes about 8 years to fully develop after we're born.
Hmm.
Any antibiotic during that time can disrupt, well, of course, the intestinal microbiome. Okay, we would always say that. Even it would do that in an adult where antibiotics disrupt the intestinal microbiome. You gotta fix it after that. But in this situation, what happens is infections that get into our body from the outside world. Those are the ones that drive chronic disease, but also the obvious ones like, you get a cold, pneumonia, bronchitis, those kind of things, but also the ones that drive chronic disease. They have to get in through our barrier tissues. The skin is a barrier against outside world to us, but so is the gut, because anything in the outside world gets in our nose, mouth, we swallow it. So the gut wall, that's why leaky gut is so bad. It's a barrier to keep bad things from the outside world getting into the bloodstream. Our lungs are barrier tissue. We can breathe things in like bad bugs. They can get past the little air sacs into us. That's a barrier. And so we have special immune cells. They call them the fierce first responders called MAIT cells, M-A-I-T, mucosal associated invariant T cells. So T cells are part of the immune system. Okay, they either create inflammation or get rid of inflammation, or they regulate everything like Treg cells. And so these MAIT cells are specially designed to sit on our barrier tissues, and they go after any bad bug trying to get in to kill us. They don't care what kind. First responders, doesn't matter what they're, is calling for this response. It's not like the adaptive immune system where you have to make antibodies against a specific bad bug. Oh, a cold virus. Well, I better make some antibodies and we'll get rid of it in like 4 to 5 days. And you don't have a cold for 20 years, you have a cold for 4 to 5 days. But these MAIT cells on the barrier tissues, they're there to get rid of it right now before it gets in and starts creating any issue, right? Well, it turns out, how do you train MAIT cells to know what bad bugs look like? So it turns out that bad bugs that try to get in this way, they make riboflavin, one of the B vitamins for us, B2. I'm sorry, they make riboflavin for themselves because they are trying to make a B vitamin, riboflavin B2, so that they can be, more powerful and do more damage. But in the production of riboflavin, they make a byproduct of riboflavin metabolism. That's what these MAIT cells look for. This byproduct of riboflavin metabolism. You're a bad dude. You're a bad bug. I'm going to whack you before you even get in to mess us up. Well, how do the MAIT cells learn this? Well, it turns out there are good bacteria in our gut that make riboflavin, and thus the byproduct of riboflavin metabolism, to teach the young immune system what to look for when bad bugs are trying to get in from the outside. And so what they said is any antibiotic the first 8 years of life, by killing the cells in the gut that make riboflavin and this byproduct, the immune system MAIT cells can't be educated properly your whole life, basically. So what they said, and I thought this was cool because I know you teach everybody the same thing. If you take an antibiotic, Scripps says, you need to take a probiotic. right? Because they're going to kill the good bacteria in the gut. You need to build it back up again, right? Now, typically I'll say, if you take an antibiotic, take a probiotic 2 hours afterwards. Let it get out of your gut, put the good gut bugs back in with a probiotic, and then keep taking every day for 2 weeks at least after you stop the antibiotic. But when they said this, I go, holy crud. All the probiotics that I recommend for my folks, like Megaspore probiotic, one of my own called Healthy Gut Probiotic, another one that's really cool for like young people, kids called HMF, Children's Probiotic. I use those three basically. I go, uh-oh, do any of the good bugs in there make riboflavin? Am I actually doing like, crud, maybe I've been missing something. Well, I looked at all three of them. I go, whew, yeah, those are the ones that make riboflavin. And so like, oh, I dodged that bullet. I was really fortunate I picked those because they're the ones you want to use for this thing. So it's like, oh my gosh, it doesn't just whack the gut microbiome, which inherently whacks the immune system because 80% surrounds the immune system. It actually, whacks the education of the immune system that is involved in all chronic disease, not just the classics, but heart attack, stroke, dementia, Alzheimer's, autism, osteoporosis, cataracts, macular degeneration, kidney disease, all this kind of stuff. It's like, oh, that was such cool research, I thought, that, tells us how important probiotics can be, but also, how bad antibiotics can be, a lot worse than I think most of us think.
Yeah. And obviously there can be a time and a place, and they can potentially save a life if and when that time comes. However, they're used, unfortunately, just so much more than what they really need to be used, and damaging a lot of people. And so
And people
something to
need
be
to know
mindful of as a parent.
what to do to kind of mitigate the negative impact if you're
Yeah.
trying to get the positive impact, right? And that's kind of medicines in general. I'm doing this med for this positive impact. Let's try to help people avoid, the negative impact that thing would inherently produce.
Okay. So we've got just a couple minutes left, and I want to ask this last question before we have to go here. But what are maybe your top two or three lifestyle tips, everyday things that moms and families should be focused on to have the biggest impact in protecting our immune system and protecting our gut? What would be your top two or three lifestyle tips that we should be paying attention to?
So the first of two, because they're very interconnected, of vitamin D. So you hear a lot about vitamin D. You hear a lot of more traditional medical docs poo-poo this importance, but every cell in our body has a receptor for vitamin D. So every cell in the body needs it. We just don't make it from sun exposure like we used to. Now there's more, but then the big problem is receptors for vitamin D can become resistant to vitamin D. And you can have all the vitamin D in the world, a little bit like that insulin thing we talked about, but if the receptors for vitamin D are resistant, it can't find a place to attach to tell the cells what to do. Turns out there's more vitamin D receptors in the gut than any other body part. And back when that was found out, they go, wow, vitamin D must be even more important for the gut than any other body part. But when vitamin D receptors in the gut become resistant to vitamin D, it messes the gut up in a way that then messes up everything. And so the original data, 2018, I'll do a little bit of a shout out to the University of Illinois, Chicago researchers who figured this out, is, well, if you fix this, you will get rid of autoimmune disease of the gut, ulcerative colitis and Crohn's disease. But also you'll get rid of recurrent infections that are really troublesome to get rid of, recurrent H. pylori and C. diff infections. And then they said, well, but this looks like if you fix the gut this way, by fixing the vitamin D receptor resistance, it'll fix anything. 6 months later, a big study came out from the same researchers. They called it a nuclear weapon against metabolic disease, diabetes, obesity, cholesterol. 2/3 of Americans are pre-diabetic. It's big topic. But then Harvard Journal of Psychiatry came out like 2 years later and goes, hey, if you fix the gut this way, and it's very specific kind of ways the gut changes when you fix this, you can get rid of major depressive disorder. Another psych journal says it changes personality types. People become more outgoing and social. And then I did a whole series of videos last fall that this is exactly what you want to do. I showed the studies, right? Scientific studies behind it to prevent breast cancer. So what you do is use three things. I call it the foundational triad: vitamin D, People know about that. Probiotics, we already talked about that. And there's something called butyrate. Now, butyrate may not be quite as familiar to folks out there. It's made by the good bacteria in the gut. It's called the short chain fatty acid. Once again, here comes the gut and the microbiome thing, but it gets disrupted and your bugs won't make it. You take it as a capsule along with these other two, it fixes the vitamin D receptor resistance to become sensitive again. Vitamin D, ideally you want the optimal amount on a blood test, at least 70 to 90, probably 90 to 100. So now it can attach to do the work, and it fixes the gut in the way that, of course, fixes the gut, but that you can fix everything. All the stuff I mentioned, plus more kind of a thing. And so it's really fascinating, the changes in the gut, including build the good, get rid of the bad, get rid of inflammation. The lining of the gut starts making protein specifically to keep away bad bugs forever. One of the classic things that happens is a really important good bug called Akkermansia muciniphila. That's in the news a lot nowadays. Numbers go up when you fix this. And so that's when you see these studies where you go, hey, if you fix the gut and Akkermansia goes up, you can do all this stuff. And you go, well, that's fixing the vitamin D receptor resistance. So I don't use that probiotic. It's quite expensive for probiotics. But I'm like, well, if you fix this vitamin D receptor resistance, you're going to make it on your own. It's cool how this works. And then you fix all of this stuff, including getting rid of breast cancer risk, fixing brain stuff, and all these other things. And of course, you fix the gut in the way that fixes the immune system, and now you're getting rid of autoimmune disease or preventing it in the first place. Really 3 big supplements that are lovely to take all together.
A mic drop moment. I feel like we just dropped an atomic bomb. You just cured basically everybody of every condition right here on this podcast.
Well, this is why you talk about the gut, right? It's like, that's why you talk about the gut, because it is such a central mechanism for all that's going on. Yeah.
Absolutely. Name any condition out there. If your gut is unhealthy, that condition is going to be worse. And you're not going to have very much luck making a significant impact in whatever condition you're talking about until the gut is improved at least. So thank you so much for taking the time to join us. If people want to learn more about you, if they want to learn more about the work that you're doing, where could they find you and connect with you?
So you can find me at drdavidbilstrom.com. And I have courses for non-medical people. I have courses for medical people to learn this stuff, because knowledge is power, including for the non-medical people out there who have been told, we have no idea why you got this. We have no idea how to make it go away. All the power has been taken away from you. You are just a passive bystander in this whole process that's going to get worse and worse. So I think it's important when people get this knowledge, they feel empowered. They're like, oh, all right, I know what to do. And I think if people feel empowered with the outcome that they're going to have, a good outcome, right? I think you're halfway there already. So I also got videos about this stuff. Usually I'm holding up a scientific study. Look what this says, right? Now I tend to be doing that on top of a mountain with my snowboard, hiking, biking, something like that. I love to get outdoors. Nature's great. So all kinds of blog posts. So I just want to educate people about this stuff so they can feel empowered and change their life, but also, like moms, they're going to change their children's life. They're going to change their aging parents' life. Eventually, they're going to rope their husband into getting healthier too, even though he doesn't think he needs help. Wife is like, yeah, you need some help, maybe more than my kids and my aging parents. And so they're the gatekeepers of health for the whole family. So this is all kind of designed ideally for women to help themselves, but also to help their entire families.
That's great. Well, your links, I'll put your links below this episode. If you're listening on audio, it's going to be in the podcast description. If you're listening or watching on YouTube, it's going to be in the description right below this episode. Again, thank you so much for taking the time to join us. And thank you for sharing so much helpful and useful information.
Thank you, Joshua. My pleasure.
Thanks for tuning in to the Discover Health podcast. Remember, your health is a journey, not a destination. Keep exploring, and we'll see you next week.